Welcome to Open Your Mouth. I'm Dr. Richard EIDELSON. Well, on tonight's show, we have some great experts. Dr. Thomas Romo, a plastic surgeon at Lenox Hill. Dr. Earl Gluck, a psychotherapist practicing in Brooklyn. And we're going to talk about the realities of cosmetic dentistry, cosmetic surgery. Won't you join us in a few moments after these commercial breaks? So, Thomas, did Michael Jackson really only have surgery 2 times? I mean,
I doubt it.
I mean, why did he say that on national TV? I mean, is it true? Is it not true? Did your colleagues say, you know, this is just a lie?
Every colleague and myself, I think that just from my own appreciation and colleagues I've spoken to do not agree that he's only had surgery done twice. So why he said it, that would be Earl's domain of why a person would deny what surgery they had. But from just looking at his characteristics and that show, the interesting thing about that show was that you could see him as a child, then you saw the way he looked now. And you can see that there's dramatic changes. For him to say he only had a little work done is ludicrous.
That's like someone coming in my office saying they had their teeth crowned or they didn't have their teeth crowned, and you could see that they were crowned. From a psychological point of view, we have Dr. Gluck here from Brooklyn. Why would Michael Jackson say that?
Well, from what I understand, I didn't see the show, but Michael seemed to have had a terrible childhood. He seems to want to perpetuate that childhood, and in his mind, he may have wanted to believe that that's all it took was twice. He wants to be continually young. He doesn't seem to want to grow up. And
did you see that interview?
No, I missed the interview. But I've read different commentaries and different people.
This goes along the line what we were talking about before about cosmetics and why people have them. What would you say the #1 reason why someone like Michael Jackson would have his whole face changed?
Well, everyone wants to feel accepted. I mean, the object of growing up is to feel like you're accepted, you belong, that you're liked. So for Michael, obviously he wanted to change from what he was. What he was, he didn't identify with. He felt a lot of negative feelings. He wanted to move towards a new look.
You know, when someone comes to my office or Dr. Romo's office, they want to look natural, they want to look real, they want to look like their contemporaries. Is he trying to do that, or is he trying to set himself apart?
Well, for Michael, I think he would try to set himself apart. I think he wanted to move away from where he came from his family. Not necessarily his ethnic roots, but his family's roots.
So, Dr. Romo, if Michael Jackson came into your office tomorrow and said, I wanted to change something else in my face, would you do it? How would you treat them? What would you say? What would the people in your office registering him as a patient, how would they go about that?
I think that's a good point, what you just said right there. As a plastic surgeon, you have to look at the individual as also as a patient. You said he registers as a patient. I think he has been mal-served by the doctors who've been treating him. I think that he has done too much. And part of the responsibility as a physician and a surgeon is to say when enough is enough.
When you say too much, what is too much? I mean, someone comes in my office, they want a beautiful smile, they want the cover girl smile. What is too much? I mean,
well, I mean, again, as Earl was saying, that he is actually a performer, professional, and he wanted a very stylized look. But in fact, when you look at, like, particularly his nose, and I understand that from colleagues of mine in Beverly Hills, that he's had his nose done multiple times, that he's at the point where something could happen to that nose because of the fragileness, the number of times it's been operated on, where he could actually end up with a nasal collapse or a real problem with a breathing problem.
You know, he said in that interview you could count on 2 fingers the amount of times he had surgery. So even in an office, when a patient fills out a medical history in my office or in your office, do you have to also look at that and say, is this person telling the whole story? Most of the time, it's what's not on that medical history, point of view.
Absolutely, and that's why it's important to spend time in a consultation with the patient, and you have to really try and ferret out what they want. Are they really telling you the truth? We have patients who bring in pictures. That's a real interesting topic in itself. We'll have patients bring in a picture and they'll say, well, I want to look like Brooke Shields, and you have to decipher.
And I'm not a psychologist. He said he's in love with Brooke Shields.
And you have to decipher from that, does this patient really want to have kind of like the highlights of Brooke Shields, or does this patient really think that they can look like Brooke Shields? I mean, you can't.
From a psychotherapist point of view, do you have patients in your office that say they don't feel well and they say, maybe I'm contemplating going to a cosmetic dentist or a cosmetic surgeon or some type of doctor to change their physical?
Normally the first thing that I would assess is whether or not that they're stable enough to even reach your office or Dr. Roma's office. because there needs to be, for a person, a sense of self in order to build upon that self. If there is no sense of self at all, if the person has severe mental disease or is a borderline personality, they would not benefit by going to you.
Have you seen patients that have had cosmetic surgery come in your office?
I've seen patients who are normal, have maybe some low self-esteem, who, with treatment with cosmetic surgery or cosmetic dentistry, that it would change their life. It would build their self-esteem. They would get a lot more attention. They would be now noticed where before they would be ignored. And that, taking the person being a basically normal person, would change their life radically, and it really is very therapeutic.
Now let's take Ivana Trump. The stories that you read in the Enquirer or the National Globe or the different newspapers, that she went out and went to a cosmetic surgeon and said, I want to look like Marla Maples. Is that a syndrome of psychology? Is that a problem you had to deal with in your office? Did every girl in your office come and say, I want to look like Marla Maples after...
And that, again, from a psychological point of view and plastic surgery, you have to be aware of that. And one of the real fallacies is, and carrying that on more commonly, is having a woman who comes in who's having problems with her marriage, maybe, and I hate to put this gender as a woman, but a woman come in having problems with her marriage, the husband may not be paying enough attention to her, maybe running around, and she thinks by having her facelift done and looking more youthful that it's going to save her marriage. And there may be multiple other problems, and it's imperative, because if you do her facelift and then her marriage doesn't survive, she may come back to you and say, you know, really be very unhappy with what her goals. So it's very important that as a surgeon we establish a common goal. This is what we're trying to get out of this: a rejuvenation, a better look, but something very realistic.
Well, I would say this, is that in terms of a woman, for instance, or a man, they see themselves, if they're single, as that they are fishes that need to bait those who are fishing. And for them, they are looking at having plastic surgery done, having cosmetic work done on their teeth, as this makes them a more potential, a more attractive candidate, and that would be true.
Well, I'm Dr. Richard Eidelson. We're discussing cosmetic surgery, cosmetic dentistry, the psychotherapy aspects. We'll be right back after these commercial breaks.